Hello everyone, good morning. This is Dr. Khan, Executive of Plastic Surgery, Bloomfield Township, Michigan. So I've just done an N block complete, 11/12/24, initials AH. 57-year-old female, implants, silicone from 2013. She had a history of right breast cancer. She had a grade 4 contracture. She had radiation on the right side. I'm going to go ahead and work on the left side first, just so that I don't cross-contaminate. I know she's 11 years past her diagnosis, but as you will see, I removed the excess skin to help with the contouring. As you will see, this is relatively spread out compared to this one, which is more contracted, if you will. And so, as you will see, some areas are thick, some areas are thin, and I'm very happy, content. There was a lot of inflammation on the left side and certainly on the right. So I'm going to go ahead, and this was done and block the gold standard. So we're going to find out if it's ruptured or not. Remember, these implants are just 11 years old. And so as I go in, who says that they're ruptured? And she had the pain on the right side. And you can see, look, if I pass my scissor here, you can see how thin this is, right? And this is the whole care and precision. And lo and behold, it is, let's see, an intact implant. So you can see some fluid around. All of this fluid that you see is contained. It didn't spill into the chest. Not enough to send to cytology. And you will see this is your 425 Mentor implant. So you can see small amount of fluid. You can see some bubbles right here. So if I go like this, I don't see much of that gel bleed, if you will. And again, as you will see, N block the gold standard. Look how thin some of these areas are. If I put my instrument here, you can see how thin this is. Some areas relatively thick, some areas thin. And I'm very happy I removed everything inflamed. And you can see this implant is very much intact on the left side. So let's see the right side. So as you can see, look at the interesting shape of it. It's like protruding out. And whenever this happens, this is a rupture till proven otherwise, but it could be contracted. I still do not know. These are implants that are just 11 years old, done en bloc, contracted, grade 4. So what I want to do here is I want to show Baker's classification. There's 4 grades. This is a grade 4 that she has. The chest breast tissue is deformed. Implant is palpable and visible and painful. That's what makes it a grade 4. And so I'm going to go ahead and now cut this open. A lot of inflammation on this side. I just want to show this tissue is not healthy. So let me show you. Let me dissect this one. This tissue is not healthy, and it needs to go to pathology as well, so that we can rule out any inflammation. And let me go ahead and cut in here. Actually, it's a little bit tight over here. You can see the hardness. Let me go in from here. So we'll go in. This is indeed ruptured. You see, look, I want to show you this. This is the take-home message. Imagine the surgeon is rushing through this area. You see how thin this is? I'm actually going to do this just to show you. If I slide the ruler, look how transparent thin this area is. And the whole surgery is about precision. Imagine you cut into this, and now as you're dissecting, you squeeze more of it out and this spills into the chest. That's bad, especially if there's fluid, whatnot else. But you can see how thin this area is. And no matter how thin, you have to remove it in a very nice, pristine way such that none of the silicone spills into the chest. Because that's the whole operation in itself. And as I pull this out, you will see and block the gold standard is no one can negate this, right? Because we don't want it to spill. And as I pull this out, you will see there's nothing over here that's grossly to the eye abnormal. I always like to check. Remember, I cannot tell anything. The pathologist has ruled it out. And you can see the stickiness, grade 4 contracture. None of this leached out. And let me go ahead and see. .425 Mentor as well. So look at this. There is a big school of thought that says, so what, the implant ruptures? So what, the capsules are left behind? Remember, if you just listen to the patients, and that's a big deal, just listen to the patients who have had their capsules left behind. A good number of them have not fully, completely recovered, and that inflammation, the badness was left behind, even though you have super paper thin capsules. And we know from the pathology report that there is silica / non-polarizable materials, implant particles that, as you can imagine, have been contained and leached into the periphery. And so this is where the end block is the gold standard. Now I will tell you, this is how consistently I've done the procedure. So if you will, the con procedure, number one, no lift needed. Now I will tell you, even on her, she's 57, I'll tell you, I'm very happy how she looks. And she truly did not need a formal lift. We'll see how she does post-op, even though she's 57. Now remember, she's got a grade 4 contracture and a lot of extreme inflammation. You do not want to be doing something fancy, let's say, even if she needed a lift. But you will see, hopefully time will tell, she did not need a lift because of the way how she's closed. No drains required. Clearly the blood loss was less than 5 cc's. Pathology, the capsules will be sent to pathology, rule out the BIALCL, CD30 analysis, rule out breast cancer, any abnormal pathology. Microbiology, aerobic, anaerobic, and fungal cultures are going to be done. High definition pictures, videos of the chest. That's the most important thing if you ask me. So every surgeon must produce a high definition video of the chest showing complete removal of the capsule. In my practice, at least, this is what I say I do, so that the patient must feel confident and comfortable that all of it was removed. And also what we're doing right now on the table, cutting open of the capsule. Now remember, this is a mindset, this is a philosophy of the practice. Deep IV sedation, twilight anesthesia. Implants are always returned to the patient. Last week I did a case and the patient said she had saline implants and she ended up getting silicone implants. So this is why it's important to always return the implants to the patient. Number 8, all patients get the same surgery regardless of their underlying medical problems. If they have a high BMI, they're done at the hospital. If they have underlying medical issues, they're going to be done at the hospital. So this is the manner where I've done all my surgeries persistently. I cannot imagine 20 years from now anyone else doing this surgery any differently. There is no shortcut to this. It takes the time it does. And overall, I'm very happy and content with how this surgery went, how the surgeries last month went, last year went, and all these years that I've been doing this. And the whole goal is do no harm, get it out in a pristine way such that when we look back at it, number one, all of that capsule was completely sincerely removed, preferably an end block, which is what we see today, or 100% total capsulectomy. And number two, everything that was removed was tested, so you have the peace of mind that there are going to be no surprises awaiting you. So there you have it. This is Dr. Khan, Executive Plastic Surgeon.